the September breakfast meeting with the Nigeria South Africa Chamber of Commerce, the General Manager Public Relations for Chevron Nigeria, Mr. Deji Haastrup, shared with stakeholders how its investment and special intervention projects has improved the healthcare sector.
Chevron focuses on three key thematic areas in Nigeria. These are health, education, and economic development or economic empowerment. We try to raise the standards of education in Nigeria, especially by involving our secondary school students in competitions, such as the National Art Competition, Krisikome Essay Competition, Science Competition, and we also grant scholarships. We have 3 different scholarships: the Agbame Scholarship, which focuses on engineering and medical area. We have Community Scholarship, which focuses in the Niger Delta area where we have our operations. And then we have the Chevron Joint Venture National Scholarship, which covers the entire country. We have over 54,000 beneficiaries, and we've spent more than 2.6 billion naira in that area. Agbami scholars alone, 9,617. 700 of these graduated with first and second class upper degrees in the 2013-2014 period. We probably have more first class graduates from our scholarship programs than any other contributor to education in Nigeria. We have a special scholarship for the visually impaired and physically challenged. This is an area that is enormously neglected in Nigeria today, but it's an area of great need. In many of the riverine areas, I don't know how many people are familiar with the Niger Delta area, but there are several communities that are inaccessible except only by boat. And therefore, many of the people who live in those communities are almost completely cut off from the Nigerian health system. When I started out in Chevron, some of our communities would have to travel at the very least 50 kilometers by waterway to get to the nearest hospital in Warri. That's until we built the first non-fee paying hospital in Madaho, which is right across our Escravos terminal. We had a situation in, I believe it was 1997, when a woman actually gave birth to her baby on the waterway in a canoe while they were transporting her to the hospital. That's how bad things can be in some of those communities. But things have changed. A lot of it has to do with some of the things that Chevron has done, but we have been doing this in partnership with state and local government. So things are a lot more, they're a lot better than they were in the early days. But one facility that we are especially proud of in Chevron is the Riverboat Clinic. It's the first of its kind, and it's probably the only one of its kind in the country. This is a purpose-built riverboat that takes healthcare to local communities in those riverine communities. One of our major thrusts is, of course, the prevention of mother-to-child transmission of HIV. As I said, the foundation of our health program is, first of all, the well-being of our employees. I'm proud to say, and I'm happy that Dr. Fagade is here, that in Chevron, we have recorded so far 0 mother-to-child transmission of the HIV virus. You all remember when we had the Dana airline crash, several of the victims could not be buried for almost 6 weeks. Some of them, it took close to 3 months before they buried the departed, mainly because there were no DNA laboratories in Nigeria to test the victims. And so many of the samples had to be sent abroad for testing before the corpses were identified. It was in the wake of that tragedy that we were approached by the Lagos University Teaching Hospital to sponsor a DNA laboratory. At the time they approached us, we ourselves never believed that in a country as big as Nigeria, with the population of Nigeria, there was not a single laboratory that could diagnose, that could test for DNA. So we quickly put together a budget, mainly from our Agbami partners as well as our joint venture. And within a very short space of time, we now built and equipped a DNA laboratory at the Lagos University Teaching Hospital. This laboratory was commissioned in February. And 3 or 4 months after that, we had the Ebola crisis. And when that happened, the only laboratory that they thought could test to the samples to know if the Ebola virus was present was in Atlanta. Now, the critical point to make here is that if that sample had to be sent to Atlanta, and we had to wait until it came back, in the period of days between the time it went to Atlanta and it came back to Nigeria, some of the people that the first victim came in contact with would have gone elsewhere. They would have traveled outside of Lagos. They would have come in contact with other people wherever they traveled to. And who knows how many people would have been infected with the Ebola virus by the time the result came back to say that, yes, this patient was actually suffering from Ebola. So that was a unique, we ourselves didn't know this at the time. It was a professor at the Lagos University Teaching Hospital who revealed to us how things happen. And sometimes some of these things you do not get the benefit immediately, but they continue to provide benefit for the future.
For the chairman of the N-SACC, Mr. Fulusho Phillips, it is a commendable effort by the multinational giant.
You know, it's so easy for us to get too concerned about foreign exchange, about recession, about economics, and fail to appreciate the fact that the essence of all these things is to improve the quality of life. So for Chevron to share with us the kind of initiatives that they have taken and they are continuing to take with respect to healthcare, health services, education, I think it was a very, very refreshing and very revealing morning. And we must commend them for a lot of work that they're doing in this area. Like I said, theirs was a nice model of how a typical organization should engage with its environment as far as corporate social responsibility activity is concerned. So I think from that point of view, we had a good session this morning.
How can we attract, the Vice President was saying that what this government is trying to do is attract more investment to healthcare, primary healthcare, and various other aspects of healthcare. How can this government really achieve that? Because healthcare is a critical issue now that needs financing.
Well, to be quite honest, you find that healthcare is one of the largest, biggest businesses in the world. And in as much as the essence of it is to deliver service to people who do need it, you've got to appreciate the fact that to give value, you must be able to pay for value. So I think the invitation for organizations to invest in healthcare and health services and in the health sector generally should not be seen as a corporate social responsibility type of invitation. It's one that should be seen as a business in which we're seeing investment that's going to be made in infrastructure to set up these hospitals, in management to manage these hospitals, and finally in service delivery to get the doctors and nurses and the health givers and caregivers to do what it is they're supposed to do. These are 3 separate areas in which investments can be made. And the whole idea is to say, how can we get people to invest in infrastructure on one hand, and how can we get people to invest in the whole management system in hospitals, and obviously invest in training doctors and nurses and caregivers. These are being, this invitation is being given on the platform that there can be return on investment, because you spend money, you earn money, but in return for giving a service in healthcare. So I think that the president is right, or the vice president is right, in asking people to invest, as the invitation is going out to all the other sectors as well. The same applies to education. This same type of model can be applied as far as education is concerned. So the government can get into public-private partnerships, all kinds of schemes can be made available, and there are many, many models around the world that can be followed, which will ensure that the private sector or anybody gets involved, invests in healthcare, invests in the health sector, and does so in a way that is compensating for their investments.
Chevron has demonstrated a model for corporate social responsibility in the healthcare sector, which underscores how private sector can complement the efforts of government.